guests. Today is going to be a 10-minute. I'm Dr. Pelto. I'm a podiatrist in Worcester, but I don't want to do too much talking this week. I actually brought some friends to help me with my 10-minute presentation. Both Charles and Sharon are patients of mine, friends of mine over the years. We've been through a lot of things together, and they're going to pretty much just tell their experience. I'm going to let them just stay seated if that's okay with you, but just please be respectful, pay attention to them. I think you're going to hear some nice stories. So please, go ahead, Charles and Sharon.
Good morning, I'm Sharon Molesky. Charlie and I have patients, as Dr. Pelto said, for a few years. We were lucky enough to be there when he joined his practice in Worcester, and about 11 years ago I was diagnosed with full-blown diabetes, and I work from home, so it's lucky that I didn't have to do a lot of traveling around back and forth. I used to work at UMass, but over the last several years, I was injured when I was on vacation. A left foot ulcer resulted from a very, very large blister. So subsequently, the doctor that was treating me before Dr. Pelto tried some skin grafts, and it just always seemed to open up again and just never was successful at healing. So when 2010 came along, there was a serious episode. I almost lost my toe, and Dr. Pelto was there. He had just done the practice, helped me get back up and going. I had other problems, complications from diabetes. I'd been trying to control health issues. It was not going well. And all I could see were complications, and looking around with the job that I do at home. I worked for 3 hospitals, and I just knew that there were other things out there for me, and they all were not good. So I took control. I went to, and I did research. I had a gastric surgery last November. I've lost over 80 pounds. After that surgery, within 6 weeks, in Dr. Pelto's care and monitoring, that ulcer healed up after 6 years. So I look at that foot now, and it's hard to imagine what it went through, and that I, could have had more serious complications. I had a partial toe amputation on the right, because it's hard to talk about, considering what Charlie's gone through. Mine is minor, but I did lose a part of a toe on the right due to osteomyelitis. But anyway, I'm looking at a really good outcome. I'm very happy I made the choice I did after doing that. I've recently started in the gym. I was in a wheelchair a year ago at this time. I got from that to the cane, to the surgery, to feeling better, getting back in the gym, and I'm now back doing strength training, which I really do like. I know it sounds kind of like a sick way to look at something, but I love being in the gym. It makes me feel empowered when I leave there, that I do have some choices and I can make them, and I've been fortunate enough not to have some serious issues like heart disease and lung issues that I work with patients every day that they're suffering, and I feel kind of very humble in terms of I was given a chance to try and turn things around, and I'm very lucky. So, and thanks to Dr. Pelto's monitoring and care and love.
With all of Sharon's problems, I worked for a living. I ran production control department, and then for the last 10 years I was a buyer purchasing manager for various companies, some of them like GE, Trelleborg. I mean, they're all huge corporations, Selectron. Then I actually retired, and I also, at the same time, I was in the National Guard, and I did 20 years in the National Guard, raising a young family. But when Sharon's big problem started, I didn't care about myself as much, and part of what Dr. Pelto does now, I ended up getting a very bad ulcer on my right foot, which led to amputation. So I lost my right leg, and now I see Dr. Pelto for my left leg. In fact, I did something very stupid, and I'll say it. I just got a brand new pair of shoes, and I went to Florida for a week to help my daughter with her problem. And I did too much walking, and I came back to see Dr. Pelto and gave him nightmares because I got a blister on one of my toes that actually is healed now. But it took 6 weeks But the point is that you gotta take care of your feet. And Dr. Pelto, he goes out of his way. I even have his private cell phone number. So if I have a problem, I can call him.
Emergencies only.
But he does help us very much, and I don't know what else to say. He gets a gold star.
I remember both Sharon and Charles. I think we met in I believe it was almost in the emergency room. I think we went into the emergency room. I was treating Sharon for a foot wound, and Charles was there, and Sharon said, I still remember it to this day. He said, you should take a look at Charlie's foot. And I mean, I thought, okay, I'll look at it some other day. Now, when anyone comes in, I have everyone take off their shoes no matter what. Because if I would have taken off his shoe that day, I may have seen the ulcer that didn't hurt, by the way, because he had neuropathy. He didn't feel it. And he had a condition, if anyone's heard of it, it's called gas gangrene. So it's where you have a lot of really bad infection in the skin, and it's a limb-threatening infection. But it could have been, maybe it could have been caught. But he didn't start noticing it or wanting to get it treated until he started feeling really sick. And that's where I saw them in the emergency room. And then it took years. It took years, a number of surgeries, right? We had to remove for you, we had to remove a sesamoid bone.
Yeah, I think Sharon had about 4 surgeries.
Yeah, had about 4 surgeries just to heal it. And because ultimately you do one to open it up, and you have to try to close it. Then there's some bone in there that was in the way. And it just took a long time. And people with diabetes, it's just hard because they don't feel. They don't have the gift of pain. So all of us, if we step on something, we're going to know it. But those that have diabetes, they just have no feeling, the neuropathy, and then sometimes it's poor blood flow as well, the peripheral vascular disease, we call it. But since then, I've referred you over to a couple of groups, right, or one group, the New England Amputee Association. So tell us a little bit about that. What have you?
I'm a member of the organization now, but I did spend 2 years as their treasurer on the board of directors. I just backed off on that. It's been 9 years now it's been founded, and it started because the lady Rose, who started it, had an argument with a trailer truck and lost. She lost her leg. But we have members that have other reasons, motorcycle accidents, diabetes, all that. And we actually have the same kind of goal with Dr. Pelto. If you're diabetic, it's very easy to lose a leg, an arm. And constant doctor care is the only way for prevention.
And so I think both of our missions with the New England Amputee Association and in my practice, a lot of it is doing talks in the community. I speak to their group at least once a year, and they invite me to come in. And I always tell their experience that this is the hallmark is this couple, and I'm just so happy both of them are wound-free at this time because it took a long time. And a lot of my work and their work is educating, and that's my big focus now, is trying to prevent other things. And so I put some booklets for those that want on the way out. A few booklets. This is the one that helps me the most. It's called A Healthcare Guide to Diabetes in Your Feet. So this is a good booklet for anyone that you know that has diabetes. And I give these out. I buy hundreds, as some people in the office here in the group know that they publish them for them. They print them for me. But in here it talks about the 3 ways to prevent a foot wound, the 8 steps to a complete foot exam. So everyone with diabetes should get a foot exam from some foot doctor once a year. The 4 serious foot care mistakes that diabetics commonly make, and then the 4 questions to ask your podiatrist. This is just a really nice booklet, very easy in lay terms, and I would certainly ask all of you to take one. If you know if anyone with diabetes, please give it to them. And that's the best referral right now, is someone with diabetes that doesn't have a foot doctor, or someone that has a wound that isn't healing. That's the big struggle, because if you just keep hitting your head on the wall, it's not, your headache's not going to get better. And a lot of people with foot wounds, they just think they'll go away, and they usually just don't go away by themselves. So, thanks, Sharon and Charles, for coming in, and I really appreciate them. I respect and like them a lot, and they're good friends. And let's give them a big round of applause.